So we are talking about mammograms, which is such an important topic. It's October. It's Breast Cancer Awareness Month. And, I think it's something that you're in like two boats, right? Either you are like on it and you're getting them all the time, or you're like, oh yeah, I forgot, or oh, I'm not ready yet. Why are these so important?
Right, so mammograms are super important. Statistically, so 1 in 8 women will get breast cancer at some point in their lifetime. So that's a lot.
Yeah.
And mammogram is the best tool that we have to detect breast cancer. So I always educate my patients. Cancer can be a devastating diagnosis.
Yeah.
And breast cancer is one of the few cancers that we do have a screening test for, which is mammogram. So the most important thing you can do is get your mammogram, whether it's every 1 or 2 years, depending on your risk and what your doctor determines is good for you.
What age do you start?
So typically between 40 and 50. So there are different guidelines. Yeah, correct.
That's older than it used to be, right? Or is it not?
So a little bit, yeah. So
Okay.
it used to be 40.
Okay.
So there are different guidelines. And so it's very important for you to talk with your doctor to determine what's the best guideline for you.
Yeah.
But typically between 40 and 50. If you have a family history, sometimes earlier. So it just kind of depends on your specific situation.
Yeah.
What do you say to, I just try to ask this question consistently, what do you say to the person who's watching and they're like, they have concerns, they felt something, but I'm a little nervous to like go through the whole thing, get some answers. What do you, I feel like you've encountered patients like that before. What do you say to them?
Correct. So that's actually very common. I encounter it all the time. And so I tell patients, the best thing you can do, number one, is check yourself because you know your body best and you are your best advocate. So if you feel something, you got to let your doctor know because the earlier we detect these things, the better. And so mammogram, the purpose is to try to screen and detect breast cancer early. So if breast cancer is caught at an early stage, typically the 5-year survival rate is over 99%.
Wow.
That's amazing.
Versus,
Wow.
Right. So versus if you're feeling a lump and you're coming in and saying, hey, I have these symptoms, the 5-year survival rate is less than 80% can be, So it's super important. And so personally, my mother was diagnosed with breast cancer last year.
I'm sorry.
Thank you.
How's she doing?
She's doing well. She's doing
She's
very well.
thriving.
Yes, she
Yeah,
is
she's
actually.
thriving.
But her breast cancer was detected by self-exam. So she actually gets mammograms every year.
Wow.
And so she had her mammogram the year before. She felt a lump in her breast and she told me. And so she was actually going to wait until it was time for her next mammogram. And I told her, no, you need to let your doctor know.
Yeah.
And so thankfully she did. And she ended up getting diagnosed with breast cancer.
That's crazy. I'm so glad that she did that. And it's easy. I mean, you just,
Yeah,
I know it
you fill 'em
sounds
up.
weird, but you just feel around.
Yeah, one thing I learned is like some women have fibrocystic. I have them. Too much information, right? Like fibrocystic breast. So like
Dense breast tissue.
Thank you.
Yeah.
Right, let's just own it. Let's just say what it is.
I mean, listen.
Right? And so I feel like I have to pay extra attention and I like freak out a lot when I feel anything change.
Yeah.
But sometimes I'm like, is that a change or is it just, my stuff shifting a little bit, right? And I feel like the most confidence I've found in doing that, like a self breast check with fibrocystic breast, is going to the doctor and being like, hey, can you help me with next steps, a mammogram, an MRI or whatever?
Yeah, absolutely. I have the same.
Yeah.
I have, what do they call it? Dense, right? So I constantly, they're like, oh, there's this thing. We don't know. We got to put a marker in. We got to do a biopsy.
Yeah.
I think the number one thing that I hear from people who are, I don't want to say scared of getting a mammogram, but like, a little like on edge about it is like, oh, it looks like it hurts. It looks like it hurts. I personally, it doesn't hurt me at all, but I have some friends who are like, oh, it's so painful. Are there options? Like if you're that afraid to be smushed in between the two plates, are there other options for people?
So the best option is mammogram at first. So a lot of people sometimes will ask, can I have an ultrasound?
Yeah.
So ultrasounds are meant to be targeted exams. So they're not meant to just scan the full breast. The mammogram is the best, and the technology these days is actually better. So we have more 3D technology to give us clearer pictures, better pictures, faster exams. So the actual process is not as long, not as painful as it used to be.
I mean, really, in the grand scheme of things, it's like 20 seconds on each side.
Right,
So quick.
exactly.
You're like, if you can deal with 20 seconds, you're fine. And, you just count.
The hardest part to me was the wait. Like the wait after. They were like, go back into this waiting room. And then there were all these women in the gowns.
Yes.
Right? And I'm not going to lie. Like, it was like all the emotions. There were some women, you could tell they're there like all the time. They do this every
Yeah.
year. It's whatever. One woman walked by crying, right?
she's
and
worried.
and I'm, I'm caught up in her emotion. But honestly, like to me, that was the worst part.
Yeah,
And
the waiting is, yeah.
And it's funny, all of the mental preparation you do too. I don't know if this is you, but like I'm like Google Queen, TikTok Queen.
Yeah, no,
you know?
don't get on
don't.
Google.
That's what you should not do. Yeah.
No,
I know.
like we're all basically dead in 14 seconds if we get on
I
Google.
know.
You know what I'm saying?
I know.
So let's talk about this weekend because you have an event on Saturday. It's 9 to 4 at St. John First Missionary Baptist Church. So what are you guys doing there?
Yeah, so this is a great community partnership that my office is sponsoring in conjunction with the healthcare ministry at St. John. So we are doing a free mammogram event for the community. We'll have the mobile mammogram bus there doing mammograms for everyone, insured or uninsured.
Oh, nice.
And so for women who do not have insurance, we do have vouchers to take care of the mammograms.
wow.
That's awesome.
Yeah.
I love that. And so then what do they get read right then and there? Do they get sent to their doctor? How does that typically
So
work?
both. You do get same-day results. It's about a 10-minute appointment. They have a radiologist on staff, a breast-trained radiologist who's going to read the results. So you get the results same day, and we'll also send the results to your doctor.
That's amazing.
Are you asking people to register? I know there was like a QR code on the flyer. Are you asking people to register, and where can they go to do that?
Yes, we would like you to register in advance at WeThriveMD/Mammo, MAMMO. And so if you have insurance, you'll just go online, put your information in, and schedule your appointment. If you do not have insurance, you'll put your information in. We'll send you the application to fill out so that we can get the voucher, and then you'll get scheduled.
That's awesome.
Why is this important in our community? I mean, I think it's obvious, breast cancer and free, right? But from what you see, from your perspective, you've worked in the community for a while, you now have your own practice. Why was this important for you to launch?
So the biggest thing is access, just to bring the access into the community. It's on a Saturday because a lot of the common things are, at work, I can't get off to get to the
Sure.
radiology center,
Sure.
and then I can't afford it. So actually one of the women we're helping with this event, she's had symptoms in her breast. She was seen before, and then she got a prescription to go do the mammogram or ultrasound. Well, it was going to cost her $500 out of pocket.
Wow.
And so she never followed up because she didn't have the money, and she didn't know that there were resources in the community to help her. So we're really targeting uninsured women. Our goal is to screen 40 women. So we have about 6 appointments left. So if that is you, if you need assistance, please reach out to us. And if you're unable to make it on October 25th, still reach out to us because we can help you year-round. The program that helps uninsured women, it's a Florida program. It's all year-round.
Oh, that's awesome. Yeah, there are so many amazing organizations and resources in our community to help with all kinds of stuff, not just mammograms. So just ask because sometimes you'd be surprised with what you can get.
That's right. That's right.
You know?
Partners for Breast Cancer,
Yeah.
all different types of organizations.
Yeah.
Correct. In this actual program as well, they help with pap smears. So
wow.
pap smears, the cervical cancer screening. So it helps with both.
Okay, awesome.
I love it.
You guys are doing good work in the community.
Yeah, we appreciate you. And congratulations. I mean, this girl opened up her own practice.
I know, that's a big
So
deal.
That's a big deal. We love all the women things.
I kind of love the pink scrubs. Is that
Thank
just
you.
because it's October or is it always pink?
Just right. For Breast Cancer Month.
'Cause I'm
but yes, I
like-
like them as well.
I would wear that every day.
It's cute.
It's beautiful.
Yeah, thank
It's
you,
beautiful.
thank
Well,
you.
we appreciate you coming in. Bless you. Did your head just hit the microphone when you sneezed?
My headphones did.
Good thing we have a doctor in the house. Oh my goodness gracious. She thinks we're a hot mess.
Well, we kind of are.
We are. All right, Dr. Alyson, thank you so much. We appreciate you. And one more time, give me the website just in case people need more information.
Yes, WeThriveMD/Mammo, MAMMO.
All right.